My name is Dr. Elizabeth Harris. I'm a board-certified plastic surgeon. Some of you may be considering cosmetic surgery of the breast, and I'm going to be discussing different options available to you for this type of procedure. The different procedures include a breast implant, also called breast augmentation, as well as a breast lift, also called a mastopexy, and breast reduction, and I'm going to discuss each of these. Why do women want to have cosmetic surgery of the breast? Frequently, the reason is after children and after breastfeeding. The breasts begin to sag and have lost a lot of the volume that women used to have before that process was done. So there are different options available to patients that are concerned about the appearance after breastfeeding, whether their breasts are too small, whether a woman's breasts have begun to sag, as well as if they're too large. I'm going to start off talking about breast implants. Breast implants are performed with a board-certified plastic surgeon, and the different options that a woman has include the size, the incision, as well as silicone versus saline, and I'm going to talk about each of these factors. First and foremost, breast implantation surgery and breast surgery in general should be very natural. They should not look too large. They should not look as though they don't belong on a woman's body, and a good plastic surgeon should accomplish the goal of very natural, aesthetic, youthful results. And one of the important factors is choosing the size of the implant. And again, choosing an implant size that is proportional to a woman's body. Essentially, if a woman's breastfed and she's lost the volume of her breast, how do we choose the size that would just basically replace something that was present when she was younger? And that's one of the factors that I discuss in great detail. And how I do that is by measuring a woman's breast, having her try on different size implants. And she looks at herself with different clothing in the mirror and allows herself to choose a size that she thinks will meet her needs. And after that, I go through my qualification process in regard to how do I choose the size, and I tell the patient exactly what type of implant I would use and what the volume would be, so that the night before surgery she's not lying in bed with her eyes wide open, worried about whether a surgeon has thoroughly understood what she does want. So that type of decision-making process should be done beforehand, again, for patient satisfaction. The incision with silicone implants, most commonly the incision is underneath the crease of the breast. And the silicone implant is, as I have in my hands, it's a pre-filled implant, and it has a very soft, natural feel to it. But because it comes pre-filled, we have to make the incision at the base of the breast to accommodate the size of the implant. And from that standpoint, the saline implant does not come pre-filled. And so what we're able to do is roll the implant up before placing it in the pocket and filling it once it's in place. So we can use a saline incision of approximately 1 inch, whereas a silicone implant incision is sometimes 2.5 to 3 inches in length. From that same standpoint, we have controversies in regard to the silicone implants that were at a height during the 1990s. Silicone implants now are able to be used freely for patients considering breast augmentation. They have a very soft, natural feel, and they are an excellent choice for breast augmentation procedures. From that standpoint, the silicone implants have gone under incredible scrutiny, and for them to be brought back on the market shows that they are a very safe product. The breast augmentation procedure is usually done as an outpatient, and the healing process usually involves the implant being inserted under the muscle, and these are the different placements that are possible. This particular diagram reveals a subglandular or underneath the breast insertion, and this diagram shows a placement of the implant underneath the muscle, which is right here. Under the muscle gives you a little bit more of a natural coverage, reduces the risk of more severe scar tissue, and has, I think, a more softer teardrop shape appearance. The healing process involves approximately about 6 weeks of softening and settling of the implant, and after it's completed, you can do anything in regard to exercise, and it's associated with no loss of strength or changes of the function of the upper body. Another different procedure is a breast lift, also called a mastopexy, and this is for a patient who is happy with the size breast that she has but is unhappy about the sagging. Most commonly I see this after breastfeeding. With women that have lowering of the lowering of the nipple, the nipple when it drops down to the lower pole of the breast with sagging of the breast involves a tightening procedure procedure. The nipple is brought up to a higher, perkier position, the skin is tightened, and the loss of fullness superiorly may be corrected if a woman has enough breast tissue. Some women do not have enough breast tissue of the upper breast, and we can combine a small implant with the mastopexy surgery to tighten and give women a perkier, rounder, more youthful appearance. The usual incision that I use for this type of surgery involves a lollipop-shaped incision. That's an incision around the nipple and leading down in a vertical line. Some other incisions involve an incision underneath the crease of the breast, and I do not do that procedure except if somebody has had massive weight loss. So it is very possible to do breast lifting procedure with more limited scars and with a very pretty soft contour. Finally, breast reduction surgery can also be done if a woman has breasts that are too large, causing her back, neck, and shoulder problems. And reducing the breast, bringing the breast into a, again, perkier position, rounding the breast so it has a very aesthetic, youthful appearance is possible. And in my practice, I'm able to do that usually, again, with a lollipop-shaped scar. The incision underneath the crease of the breast can be done in more serious, larger breasted patients, and some plastic surgeons do it with different techniques. My technique involves keeping the nipple attached, so there is still the chance of more natural sensation as well as more natural contraction of the nipple. So in order to have the breast reduction procedure, I talk to a patient in detail and I ask them what type of size that they would like, and I show them photographs to better explain the procedure. All of these procedures are performed in a hospital operating room, usually as an outpatient, and I also have a board-certified anesthesiologist that does my anesthesia. Safety is always a big factor in choosing a plastic surgeon. That considers safety as the primary choice is very, very important. The plastic surgery process involves sometimes having to choose a plastic surgeon in your area and to contact the American Board of Plastic Surgery in your website would be helpful. My name is Dr. Elizabeth Harris. I practice in San Antonio, Texas, and my website is eharrismd.com, and my phone number is 210-545-4848.